Hello and welcome to this short walkthrough of my Tableau script data story titled Flu Mortality Trend and Staffing Insight. And today our objective is to analyze the provided data-driven recommendations to medical staffing agencies, helping them prepare efficiently for the upcoming flu season. And we are using this CDC influenza mortality data from 2009 to 2017. And I explored geographic and demographic pattern to identify high-risk states and age group. So let's dive into the visual story and uncover the key findings. So we will be having our second slide of geographic trends, and we have here the data from 2019 to 2017, as I mentioned earlier, and this is a line chart from 2009 until 2017 December. And we are having here two objectives. First is business concept, and the second objective is to analyze the further investigation and what can be done. And in the business context, we can see in the medical staffing agencies plays a critical role, and it supports the hospitals and the different clinics during the flu season. So this is to ensure that we can have the adequate healthcare coverage, especially during the peak periods, and we can have the effective and efficient planning, which is very essential for this country and for the different states. However, the flu-related mortality rates vary significantly across states and population groups, and it makes very crucial to understand geographic and demographic trend. So by identifying this area where we have the higher flu-related death rate, agency can strategically allocate temporary healthcare workers to make this in a zero way, like to optimize the resources and to make it in a zero way. So we identify geographic trend. So we are analyzing how flu-related death vary across US states from 2009 to 2017 to highlight region with consistently higher mortality rates and compare total versus high risk population impact. So evaluate flu-related deaths rates among the general population and vulnerable 75% age group to understand demographic disparities. If you see the chart, we have the most deaths in the California area, and we can see the graph line. In this line chart, we can see that it is always upward and going down, but the higher rate is in California, and the second one is New York, and the third one is Texas. So these are the top three states where we're having the highest death rates. So moving forward, and where the third slide is where is the highest demand. So in this one we can see where is the greatest need of seasonal healthcare support. So this curve plot map visualizes flu-related deaths per capita by US state. As usual, same from 2009 to 2017, and it helps us to identify the risk region with greater healthcare demands. And the insight here is states such as Wyoming, Vermont, North Dakota shows the highest flu death per capita. These are likely to require increased seasonal health staffing, especially during peak flu period. And by analyzing flu death relative to population healthcare plan, can better understand where resources and personnel will be most urgently needed. So according to this, we can allocate the resources according to the requirement. So this analysis support informed decision making for healthcare deployment, ensuring preparedness and efficient allocation of medical resources. So where we have the most dark spots, we know that it can be used for the resources, and like Wyoming, we can see we have different kind of, it is like the 5 colors, the dark, the lighter, the lighter. So the darker one Yeah, so this map focuses specifically on the 75 age group, displaying of the distribution of the flow. So darker shade represent higher death counts, with states like California, Texas, uh, etc. These states not only have larger population but also dense urban areas and senior communities, increasing higher vulnerability. This allows staffing planner to cross reference elderly population with flu mortality trends to guide their hiring and deployment strategies. So this chart shows that where we need to allocate our resources according to the demands and the requirements. So moving further, we have the where is the flu most rampant. So in this we can see that yeah. So here we have the flu activity by month 2009 to 2017 as usual, but it is the month we can see from January to December. And here we can see the flu outbreak vary in timing and intensity across region each year, while some states face severe spikes and strain healthcare system. Other experiences milder season. Understanding when flu activity is most aggressive is essential for effective staffing and resource planning. So this is the thing here. We can see different months having the different situations, and historically flu season peaks between December and February. As you can see here in the December, it is going upwards. So we can see it is increasing, and if you see here for the February, it is here. Yeah. So through this can begin as early as October and extend into May. For planning purpose, November through March requires heightened attention, with December to February being the most critical, and the temporary healthcare staffing when is the flu most rampant. So understanding when flu activity is most aggressive is essential for effective staffing and resource planning. So this line chart illustrates season trend in flu-related death, highlights a typical peak period and regional variation. So this insight enables staffing agencies and healthcare providers to anticipate demand and ensure clinics and hospitals are adequately prepared. So for planning purpose, November through March requires heightened attention, with December to February being the most critical and the temporary healthcare staffing. So definitely we require to plan everything in between to November to March, so that everything can be executed according to the plan and we can have the less death rates. Moving further, we having what would be the flow impact. So we have here bubble chart and the pie chart. In the pie chart, we can see that the less than 75 years of people having the less rate of deaths, and but 75 plus year people having the maximum death rate because they are old, they are high in age, and yeah, the survival time is like lesser than, as usual, lesser than the 75-year-old. As we can see the numbers, definitely 75 years having the greater number than lesser than 75 of years, and the same, it is the data from 2009 to 2017. And in this pie chart visualize influence, yeah, 2009 to 2017, and presenting the vast majority of death. Yeah, as I mentioned earlier, 75 plus age people, they are having the vast majority of deaths, and younger than 75 still significant but comparatively low at 89,599 fatalities. So key insight is over here: 78% of flu-related deaths occur in individual aged 75 and above, as I mentioned earlier. So if we go to the next one, the bubble chart here. So it is a chart shows correlation between the population and the mortality. So this bubble chart shows a strong positive relationship between the population age 75 plus and flu-related deaths, emphasizing the vulnerability of older adults to several flu outcome. So larger bubble indicates a higher mortality. For example, states like Wyoming, Vermont, and Montana show significantly higher flu death rates. And this visualization immediately helps identifying where healthcare providers might need to allocate more resources or staff. And these high mortality states could face seasonal surges and make lack adequate hospital capacity during peak. So these big bubbles, and these are the lower, and we have different colors according to the size and according to the states. So it depends. So yeah. So moving further, we have the next one. And what, as a conclusion, what would be our insight recommendation and the next steps to improve? So our geographic disparities are flu rate and mortality rate vary significantly by states. The higher total deaths observed is more density populated regions, and this as I mentioned, 65 or 75 age group people, they are having the highest death rate. So especially it begins, flu season typically begins in the fall, when activity rising October and peaking between December and February. So that's why we have to manage from November to February to make the strategy so that we can implement aligning with increased demand of the medical staff and resources inside. And according to geographical disparities, we have very significantly by states. The highest total deaths observed is more densely populated region, and yeah, 65 plus and 75 plus account of the disproportionate share of flu deaths. So we have the recommendations here. Priority high-risk state focus seasonal staffing efforts on states with consistently high flu mortality rates such as Wyoming and North Dakota, as we were having the higher rate of deaths over there. And yeah, ensure adequate staffing of the high risk during the peak flu months, as mentioned, December to February, to reduce strain in the medical facilities. And we can allocate the resources support to the 75 age group people in the highest risk areas. Yeah, and we can also enhance the search capacity. And next steps could be expand analysis with the recent data so that we can make more adequate and reliable things. And for 2018 onwards, ongoing trends and improve the future forecasting, strengthen collaboration in the healthcare providers, and engage with the hospitals, clinic, and public healthcare agencies to align staffing strategies, local need and capability. So this would be a great idea of having everything in right order. So it makes a real nice forecast so that we can have everything in order. So in summary, this Tableau aims to turn flu mortality data into actionable insight for medical staffing. By identifying the high risk rate, age group, and temporal trends, we can help agencies prepare more effectively for the challenges of flu season. And yeah, that's all, and thank you for watching. Yeah, and I'm looking forward to any feedback or further suggestions from you guys. Thank you so much.